Here we have our first responder kit. I'm going to go through it with you today. In our upper front pocket, we have vital related gear such as BGL, adult and pediatric BP cuffs, stethoscope, pupil torch, shears, as well as a thermometer. Moving down to our lower front pocket, we have PPE related gear such as glasses, some masks, as well as our pads, an extra glucose and saline pouch. In our large side pocket here, we have hemorrhage related gear such as tourniquets, some tape, some different size bandages and gauze, as well as at least 6 saline containers. Moving around to our side upper pocket, we have some anesthetic spray, as well as some sick bags and a cervical spinal lanyard. Moving to our lower side pocket here, we have our glucose management related gear, such as glucon and giving set, a drawing needle and syringe. We also have some extra glucose as well as some oral glucose down the bottom there. Moving through to our main body, we have on the inside lid pain management at the top here, such as tramadol, ibuprofen and Panadol, as well as our Penthrox inhaler, also known as the green whistle. And below that, we have our laryngoscope, some NPAs and OPAs and adult size forceps, as well as some lubrication, as well as our biohazard bag. Moving down from there, we have our adrenaline and salbutamol, making sure it's all up within date, as well as at least 10 ampules of adrenaline. Moving to the side pocket across from that, we have our nebulizer mask, as well as some oxygen tubing. Moving into the main body, we have a few slippery SAMs, some IV lines, a sharps container, an extra saline pouch, and some cardboard splints, as well as a neck brace. We have a towel, our IV giving kit, LMAs, as well as an adult and pediatric bag valve mask. Here we have our O2 tank, and these are easily identifiable via the white cylinder and black top. They come in a couple of different grades. You'll find a sticker on them stating whether or not it is medical O2 or pure O2. For demonstration purposes, this is an empty bottle, and typically your oxygen bottles are found on the wall of the ambulance, strapped in safely. Here we have our regulator, and to check this, what you're going to do is take off the Bodoc seal nice and easily, and check that both sides are adequate for the seal. Chuck that back on, and you'll find these 2 prongs, which line up nicely with those 2 holes right there. Putting that over the top there, you're going to do this up, nice and tight. Cool. And around this other side here, you'll see this pressure gauge. Once you turn on this knob at the top, that'll typically fill up to the green. That means there's enough oxygen in the tank to be used. However, again, this is an empty tank, so that won't be happening. Test the flow rate by turning it on just a little bit, and if you hear the sound, that means it's working. For now, I'm going to turn it back off and get our mask ready. For today's demonstration, I'll be using a bag valve mask, but you can use many different types of masks, including nasal prongs, which has got a flow rate of around 1 to 6, and you also have your nebulizer, which has got a flow rate around 6 to 8. Bag valve masks use a flow rate of 15 or more liters per minute, so I'm going to turn that up right now to 15. You typically use bag valve mask or oxygen in a situation of resus, so what you'll do at this point is squeeze the bag to about 1/3 of the depth, providing adequate breaths. Once that is all finished, you're going to turn off the flow rate and turn off the bottle itself. There's still a lot of oxygen left in the regulator at this point, so what you'll do is you'll take off the oxygen hose, and you can bleed the regulator by turning on the flow rate once again. Once that's done, you can turn it all off and detach the regulator. Make sure at all points your bottle is lying down flat while using for safety. We have our suction unit, and I'm going to start by turning this on to full, and you'll hear the machine start up. A way to test the suction is working was by including the pipe here, and you'll hear and see the suction will start to build up. Once I release the pipe, you'll hear the suction, and another way to test this is by covering the whole of the rigid catheter and touching it to your glove, and seeing and hearing the suction is indeed working. When working with a patient, you want them off to be on the side to allow gravity to assist with the extraction of vomit and blood and other excess fluids. When putting the rigid catheter into the mouth, make sure you're not covering the hole and go no further than you can see. When removing the catheter, cover the hole and do small circular motions on the way out, making sure to not be in the patient's mouth for more than 10 seconds. Complications with the rigid catheter can include soft trauma damage, inducing vomiting, as well as in extreme cases hypoxia. We also have a soft catheter which can be used for children, babies, as well as in the ambulance and in rocking conditions, making sure to not cause trauma. It can also be used through the nasal passage and if there's no access through the mouth. Possible complications with the soft catheter can also include inducing vomit as well as soft trauma. Defib, I'm going to start simply by turning it on in the top right corner there. Once that turns on, it's going to go into automatic defibrillation mode, at which point I'm going to switch it into manual mode. Simply do this by pressing advisory and move over to manual. Cool. While this is doing a user test, which I'll set up now via options, user test, that'll start doing that. I'm going to show you a bit of the gear. On our left hand side here, we have our end-tidal CO2, we have our SpO2 reader, that simply goes over your finger and tells you your oxygen saturation levels. We have our BP cuff, and we have our 3-lead. I'll get that out now because later on I'm going to show you how to attach that. Cool. On our left side here, we have our defibrillation pads and as well as our test load right there. You'll also find our GTN spray, a razor and some aspirin on the side there. Around the back we have our 2 batteries, which you can display the usage by those grey buttons right there. To replace a battery, you simply lift up from the side and those come out nice and easily. Cool. You'll also find spare paper on these machines more often than not. Unfortunately this one does not have any, but you'll also find that around the back there. Once our user test is finished, we'll get a printout saying whether or not the user test has passed, in which it should have passed completely fine. Cool. So our user test is finished printing right here. You can see that it is user test passed. Awesome. Cool. Now I'm going to demonstrate how to use the test load. Simply detach the pad part and move that to the side. Grab your test load, plug that in. To demonstrate the charge, you simply have to press your energy select level. It's at 360 joules right now. This is the perfect amount for an adult. So I'm going to start charging here. That'll charge all the way up, at which point I can deliver the shock into the test load. Cool. It's ready to shock. Shock delivered. Awesome. You can also cancel this charge at any moment using the selector knob. I'll demonstrate that now with another charge. While that's charging, or even once it's finished, simply press that to cancel the charge. Awesome. So, moving over to our dummy here, I'll show you how to attach the defibrillation nodes to the correct location. On a human, obviously you'd have pads. On this dummy, we just have these little nodes which attach nicely. So we have our lower left appendix there, and our right sternum up there. Those are the locations for a normal defibrillation to go across the heart. We also have our 3-lead here. Again, we don't have any dots, unfortunately, but this would normally go on the right leg, our right arm, our left arm, and our left leg. Cool, that would sit there nicely with the dots normally. At which point, you can move over to switch into the correct lead mode. Simply press lead, find the 3-lead, and select that. Now it's in 3-lead view. You can change the size of this by pressing size and moving to whatever you need. On top of that, you can change the HR volume, which is also known as the QRS volume. Do this simply by finding the heart rate section, pressing OK. You have here the QRS volume. Press enter, change it to what you desire. Press OK, and home screen. At the end, if you want to get back into AED mode, all you have to do is simply press analyze, and it will analyze the patient if the shock is needed.
Clear.
In the scene of 65-year-old male who has collapsed, and prior to this, he was complaining of chest pains. The patient appears pale as well as not to be breathing. The scene appears to be clear of hazards, so we're safe to enter. Our stretcher is waiting outside in case we need it. It's likely to be a resus scenario, Sam, so I'll get you to set up the AED and suction unit when we get in there.
Sweet.
Cool. Entering the scene. Hello, sir, can you hear me? My name's James, and this is Sam. We're from the ambulance. No response to verbal stimulation. I'm going to try a pain stimulus now. Hello, sir, can you hear me? No response to the pain stimulus either. I'm going to do a head tilt, chin lift to check the airway. It appears to be clear. I'm going to do a listen and feel the breathing for 10 seconds to make sure if he's breathing or not. Patient doesn't appear to be breathing. Sam, we'll get you to start compressions, and I'm going to turn on the AED now, as well as call for backup. AED to comms requesting an R50 backup.
Analyzing heart rhythm. Do not
Don't touch the patient, Sam. I'll set up the bag valve mask while we
Shock
wait.
advised. Charging. Stay clear of patient.
There, Sam.
All clear.
Deliver shock.
Alright, delivering a
now.
shock, clear.
Press the orange button now. Shock
Alright,
delivered.
start compressions when the AED says so, Sam.
Start CPR.
Alright, I'm going to be setting up the OPA and NPA now. When using the OPA, measure from the corner of the mouth down to the jaw, making sure it's the correct size. Inserting upside down and rotating 180 degrees to make sure the tongue is out of the way. Some possible complications with an OPA include such things as if the patient is having a seizure or has trismus. This will make it very difficult to get the OPA in, as well as the potential problem of causing soft tissue damage, and if the patient is conscious in any way, this could cause a gag reflex. When inserting an NPA, you want to measure from the nostril down to the earlobe, apply some lube, and insert perpendicular to the patient. This should go in. If there's any resistance, give it a slight wiggle and it will go the rest of the way. Possible complications with the NPA include things if there's blood in the nasal capacity, as well as if there are any TBIs in the patient or facial fractures. This can cause intracranial pressure to build up when inserting the NPA, so we wouldn't insert one. Also can include cause soft tissue damage as well. Cool. Setting out the bag valve mask, I'm going to plug in the nozzle to the ear and also turn on the ear and put it to a flow rate of 15. Making sure the reservoir of the bag fills up as to not suffocate the patient. Apply the mask using a CE grip with your thumb on the back of the mask and your index finger on the front, with the rest of your 3 fingers under the jaw. This allows for a good seal around the mask and around the mouth, and as well as making sure the airway is clear. A potential other grip is using the 2 thumbs on the front of the mask and all your fingers under the chin to make sure the airway is still clear. Now Sam, I'm going to get you to count down your last 5 breaths so I can deliver 2 rescue breaths.
5, 4, 3, 2, 1.
Thank you. 1. Squeezing the bag valve mask to a third of the depth. 2. Alright. Continue compressions.
Stop CPR.
Stop touching the patient, Sam.
Analyzing heart rhythm.
I'll get you to swap. You're looking a little bit
Stay
fatigued.
clear of patient. Analyzing heart rhythm. No shock advised.
No shock advised. Alright, I'm going to get you to count
If needed,
my
start
compression,
CPR.
Sam, up to 30, and then when you get to the last 5, count them down for me so you can deliver 2 breaths.
Perfect.
Cool. Ma'am, what was your husband doing prior to his collapse?
Watching TV.
Alright, does he have any medication?
No.
Is he allergic? Have any allergies?
No.
Okay.
5, 4, 3, 2, 1. Good to go.
Has he had any past medical history to do with collapses?
No.
Okay. Maintaining a good CE grip there, Sam.
5, 4, 3, 2, 1.
I'm going to continue compressions until either backup arrives or
Good to go.
or he's revived. Making sure my compressions are going about a third the depth of the body and coming fully off the body to make sure the lungs can fill back up.
5, 4, 3, 2, 1. Good to go. Five, 4, 3, 2, 1. Good.
Maintaining the CE grip there, Sam.
Yep.
Thank you.
Five, 4, 3, 2, 1.
Stop CPR.